Good afternoon, everybody. My name is Jody Hanson. I'm the Director of Public Affairs and Communication for Johnson County Government. With me today is Dr. Sami Ariola, who is the Director of Johnson County Department of Health and Environment. And we also have Elizabeth Holshoe, who's the Director of Epidemiology for Johnson County Department of Health and Environment. So thank you both for being here. I know that today we had our clinics open due to the weather being a little bit better today. Dr. Ariola, maybe talk about how today's clinic went.
Thank you, Jody, and good afternoon, everyone. Really happy to tell you that the clinic went very, very well today. I started my day over there. We started earlier than scheduled, 8:30. The lines were flowing, and there were no lines. People were going in there, checking in, getting their vaccine, sitting down for the 15 minutes, and then leaving. And checking with staff throughout the day, and had a few emails from 80 plus persons that went there for their vaccine. They're very excited, especially compared to 3 weeks ago when some of them had to be in the element a little longer than they wanted. So pretty good. We had planned for 1,400 people to come in today, and slightly over 1,300 people showed up. Again, considering the weather, that was very impressive. So it went really well.
Well, good. So if somebody didn't come today because maybe it was just too cold or they didn't feel safe, what can they do if they haven't done anything yet in order to reschedule their appointment?
Yeah, they can email us, jcdhe@jocogov.org, or call us on our number 913-715-2819 to book an appointment. But we continue to have clinics, although I believe all the appointments are taken this week. But there will be additional appointments that open up next week. And so we're planning for next week. The plan for Tuesday and Wednesday is pretty firm. Tuesday is continuing the second doses, and Wednesday is the same thing, except that those that we canceled yesterday because of the weather are those that are scheduled for Wednesday. But we're planning clinics for Thursday and Friday. We have second doses in place. So if it's your second dose and we open up clinics, we'll look for, we're still farming up some of the plants, would reach out to you to book an appointment. In terms of first doses for next week, we have opened up some of those appointments for Thursday for the 80 plus. I believe quite a few have been booked, but there's a few spaces the last time that I checked. We'll be doing some of the second doses for Moderna also, I believe that Thursday. And so if you have your second dose, just reach out to us. We're continuing to work people in. We can't really do anything beyond Thursday because of the weather. Our shipment of vaccine for next week has not arrived yet. So, and we typically don't open up appointments until we receive the vaccine. The weather, obviously, we are hearing that the vaccine is with FedEx in Memphis. So maybe it comes in on Thursday, maybe it comes in on Friday. If we do, we're also still planning to have clinic on Friday also.
So by this time, typically, would you have next week's vaccinations in hand?
Typically, sometimes it comes in on Thursday, but more recently it's been coming on Tuesdays and Wednesdays at the latest. So yes, we will typically have it by now. Again, still hoping that we do. We already have appointments open for Thursday, but we'll open up appointments for Friday if we can. But here's the good news. We just finished meeting, myself and Elizabeth, with our CMOs and CEOs of our health systems. There's a lot of activities going on. Advent, for example, has a clinic this weekend planning to vaccinate about 5,000 people. They open up their appointments, and I understand all the appointments were booked within a couple of hours. KU Med have clinic planned for this weekend also. So precisely the approach that we said is what's happening, that all of us collectively are ending up vaccinating more people together. And so then St. Luke's is doing that. Olathe Health is doing that, and we're chipping away. And so that's a good thing. If you get your shots from any of those places, that's fine. We're all working from the same pool. that's a good thing. All of those health systems are vaccinating this week. What we don't have is just supply for next week, and hopefully we get it so we can vaccinate and they can also keep vaccinating.
Do we know for those healthcare systems that you mentioned that are having clinics, are these mostly for their own patients? Are they for members of the community? What do we know about that?
I believe that they are broadening. They are broadening that. They have obviously reaching out to their clients, but they have avenues for people to sign up and indicate willingness to take vaccines, and they're reaching out to people, and that's going. So there are more and more opportunities for people to get the vaccine. And I know that Elizabeth will want to tell us what's going on with Children Mercy, because we don't ever want to forget that. We've got that 65 plus going on, but simultaneously, some really good work going on in vaccinating our educators and our childcare. Elizabeth?
Yeah, absolutely. So this week we have 2 clinics for our public school staff. And again, these are being run by Children's Mercy. It's such a great partner that we have there. We are anticipating giving out 2,340 doses to these public school educators. And after that, we will have immunized about 37% of our public school staff that have been indicated as needing a vaccine. For our private parochial schools and our childcare centers and homes, those are a little less, those are in 20%. But the plan currently is to alternate. So this week we do public schools. Next week we will focus on our private parochial schools and our childcare centers and homes. And that way we can basically move each of these 3 groups incrementally towards fully vaccinated. And we're trying very intentionally to keep them in line as we move forward. But continuing immunizations, a lot of great uptake and excitement about it. So we're thrilled to be able to do this.
That's some really good progress. So I know that if you work for probably a private school or a public school, you will be hearing from your school administration when it's your turn that they're the ones that are prioritizing the order. Is that right?
That's absolutely correct. We have asked that each of the public schools go ahead and prioritize their staff based on their needs. And this takes a number of different approaches. Some is based on critical infrastructure, some is based on age, some is based randomly. And I believe that most of our districts are doing some combination of those. And that goes the same for our private parochial schools and our childcare centers, which oftentimes can have staff up to 60 or 70 individuals. And so it's the same idea, is that each of the individuals who are running these schools or daycares knows best about what they need to be able to stay open and who's at risk within their staffing community. And so they are the ones who are responsible for prioritizing those and giving us that information about who those individuals are.
And so then what about somebody that may run a daycare from their home where they don't work for a company or a school? How are they getting vaccinated or hearing about opportunities?
Absolutely. So our licensed childcare homes, and so these are people who, maybe care for 3, 4, 5, 6 individuals, children in their homes. If they are licensed through the Kansas Department of Health and Environment and Johnson County Department of Health and Environment, we are immunizing those as individuals as well. And in fact, are prioritizing those among the childcare facilities because of the impact that they have. If the single provider in a childcare was to get sick with COVID, it would not impact that family, their livelihood, but also the families of the children they watch. And so we really have tried to focus on some of the bigger impacts that we can have. So as long as it's a licensed home, they should have been reached out to by our childcare licensing team. And we immunized a number of them last week as well.
Okay, so they didn't really have to take an interest survey or you already had their list, the list of those providers.
We did a little bit different. It was our own interest survey for childcare, but yes, they definitely filled it out, let us know.
Okay.
They had, and then we looked at how many staff they were licensed for to make sure that, that we were being good stewards of the vaccines, that we weren't having additional family members who weren't really responsible for the care of children sort of getting in. So we're trying to be very deliberate and very directed approach. We know that vaccine doses are very rare. We only have a limited amount. So trying to make sure that we immunize the right people at the right time for the biggest impact.
We have a question from Facebook about education since we're on that topic. Are school age students going to be able to be vaccinated, specifically middle or elementary school age, or I would ask high school? I mean, what are the plans for students?
So the vaccine currently not approved for anyone younger than 16. And so, I know there are ongoing studies that our Children Mercy is involved in that's looking at the vaccine in younger younger children, but for now, the approval is not for anyone younger than 16. Now, so if you have any kid that's 16, 17, 18, at some point they will qualify, not in this phase, they will more likely qualify based on age, and maybe phase 4, phase 5, depending on what the conditions are. Right now, it's not, elementary students do not qualify for the vaccines.
Okay, that's good to know.
We have been able to immunize a handful of those high school students, those who are 16 and above, with Pfizer, which is the only vaccine currently licensed for that age group, because they are actually healthcare workers. We have some students who are in CNA programs in our school systems, and so we've been able to immunize them as part of healthcare workers, since they are going into our long-term care facilities as part of their training. So trying to, again, protect those who are most vulnerable.
Okay, great. We have a couple of questions about second dose. Where are we in the schedule in terms of who was the next group you're going to be reaching out to, and when are their second doses due?
I think most people that are due their second doses this week are those that we vaccinated 3 weeks ago for Pfizer. I know we still have some from Moderna that's 4 weeks ago, so there's that overlap. And most of those are scheduled now. Like I said, last week we did a lot of Moderna second doses, and we do plan to walk some of them, the remaining ones, as much as possible into our clinics next week. So right now, I believe 3 weeks ago, our focus was on the 80 plus, and we opened up more appointments than the people that we vaccinated. Those are likely taken up. So by Wednesday next week, we believe that we will have finished the second doses for those that we vaccinated 3 weeks ago, and then we'll open up additional opportunities for Moderna. The questions that we're getting is right around those that have taken the Moderna vaccine. Again, like I said, we had a couple of days last week when we had appointments that were not fully taken up, and that's okay, that's fine. We reiterate that you have 42 days after your first dose to take it. So there will be additional opportunities next week if you're due for your second dose to get it.
Okay, I think that's great. And then somebody on Facebook was asking, should they get the second dose vaccination in the same arm as the first dose they got? Does that matter?
It doesn't matter. I don't know what Elizabeth did. I got mine the same arm. Did you get it in different arms?
I got it in different arms because the first time I got it in my non-dominant arm, and it hurt so badly that somebody cued me in that maybe I should consider putting it in my dominant arm because I use it more, so maybe it wouldn't hurt. So I tried both. I don't know that it made much of a difference in my arm pain, but yeah, it doesn't matter which arm you need it in. You get it in.
I'm seeing some more questions about healthcare systems, so I'm going to jump back to that topic. Somebody is asking, when a healthcare system says they're taking people at random, what does that mean? Do we have those details about how healthcare systems are choosing people, or is that better asked to the healthcare system, would you say?
I mean, obviously, they can provide more details than we can as to the logistics of that, but several of these health systems have tens of thousands of people in their care, and they've got to select people some way because they're just very few doses. In our case, we focus on 80 plus, and we try to walk down the list as much as possible. In some cases for the health systems, they decide to randomly select. There are so many ways to randomly select from the list and send to people. Those people again, I try to I try to ensure that the way that we're looking at this is every week that we vaccinate 6,000 or more people in this group. It's 6,000 fewer people in the pool of the 65 plus that we are needing to vaccinate. We're moving through the list. It is slow because the supply is slow. Otherwise, these details of how people are selecting are not quite as significant. And as we get more doses and as we continue to vaccinate in this group, those details will not be as important, because then you can get your vaccine from more places and there are better supplies. That's what we are kind of hoping happen in the next few weeks.
And I'm seeing some questions about when are we going to get to phase 2, tier 2, or when are we going to get to grocery store workers or other essential jobs. So
Yeah,
It's
Elizabeth.
hard to know the time frame though, right?
Yeah, Elizabeth and her team, they're working very hard to sift through the data so that we can make better projections. Jody, we're looking at the list to see how many people remain in the 80 plus category, to estimate how many people remain in the 65 plus. Still our best way of doing that is just knowing the total number of doses that are coming into the county. That's the best proxy. So if we the best measure. So if we look at that, the doses that are coming and where we are channeling those doses, we still have a few weeks to go in tier 1. And so it's very tough. I know people want us to be able to estimate, but that's a very difficult thing to do. But as we may get to a place in the next few weeks where it's easier to say that we're closer to the end of that group. But really, based on how many doses we've administered, we still have a long way to go.
Yeah, and I'll jump in here as well and say that Dr. Ariel is absolutely right. We are working to try and do that. I know it'll bring a lot of individuals comfort if we could at least give an estimation of when we would be able to move from one tier to the next. Part of this is the data, right? We need to know how many people have been vaccinated in Johnson County in these age groups so that we know where we are and how many we have left. We are continuing to work very closely with KDAG. There's a big hole for us when it comes to our long-term care facilities. If you think about those centers, those buildings, it's a lot of the individuals in our phase 2, those 65 and up. Unfortunately, they don't report to us. We can ask our long-term care facilities how many they vaccinated, but it's all voluntary. So we don't really have good numbers from that. And they are reporting to the state and the federal government who they immunize, but we're still working very hard to try and get access to that data. And we keep being promised it should be soon, but that's sort of a nebulous term. So we will continue to work. And I think once we get that data, once we can really start getting a better understanding of how many people in that 65 and up have been vaccinated, we'll be able to have some better understanding of how quickly we can move through it with our weekly allocations that we're getting.
Some people are talking about the state and their supply of doses and how low that our ranking seems to be in the country. I know that there's been announcements about the state of Kansas getting more doses. So I don't know if you know anything more about that or know how that will affect Johnson County's allocation yet.
So there's nothing official that we know. We know as we had the governor mention that she expects more doses to come. We had the same news out of the White House, but there's no official communication to us yet from KDHE that our allocation will increase. We don't know that yet. I think at least as at last week, the state was still getting the 45,000 doses. That's what they're still getting. And so, but they're expecting for that to go up. And if that goes up, we also expect our allocations to go up. And if it goes up, it just makes our job a little bit easier. It just means that we can vaccinate more people in a week and move quicker through phase 2 tier 1. I think the tier 1 is by far the largest group by far. It's not even close. Just the 65 plus and the educators and childcare by itself, at least in theory, the pool itself is about, 110, 120?
120.
120. So that's a very large group. Once we get through that, I expect the rest of the group to move quicker.
I think people will be happy to see that happening.
Yeah.
We got a question about which vaccine is Johnson County administering, Pfizer or Moderna, and is somebody supposed to choose which one they want? So maybe you could talk about the two vaccines and how that works.
Right. So I'll answer the last question first. No, you don't get to choose. So we don't even have the option. So when this started, the first set of vaccines that were sent to us were Moderna vaccines. But the past 4 or 5 weeks, it's been strictly Pfizer. And that's all that we're able to give out now. We don't have Moderna. And quite frankly, it doesn't matter. We're expecting the J&J also to be approved very soon. That's a single dose vaccine. And maybe there's a time in the future where you can say, I want this, I don't want that. Right now, that's not an option that we have here.
I do believe that the pharmacy program. So Ball's Food Pharmacy predominantly in Johnson County. I believe I read that they're getting Moderna doses, but Dr. Eric is absolutely right. It doesn't matter which one you receive. Both the Moderna and the Pfizer have really equivalent efficacy. So whichever one you can get, jump on it.
What are you hearing about the pharmacy programs as far as, are there new ones being added or any appointments opening up, or what's the best advice for people if they're interested in looking at pharmacy?
Well, so I mean, I would, I know that Elizabeth and her team are there probably, I don't know if we've talked about that, but we do need to work on making available the list as much as we can of where the vaccines are in the pharmacy. The word out recently, well, actually when they started was the plan is to continue to increase the number of doses that are going to this pharmacy and to continue to add even more pharmacies that are able to dispense that. So again, our overall plan, to kind of reiterate that, is to have as many providers as possible in the county and to make this as close to getting your flu shot as possible, which is you go to a pharmacy or you go to your primary care physician and you get your shot. That's the goal. That's a lot better than, it looks really good when we talk about mass vaccination clinic, but it's not really the best route. Mm-hmm. Those clinics should be to fill in the gaps. And so that's ongoing. From what I read, there's a lot more doses from the White House that's going to more pharmacy, and that's a good thing. Right now, we can't tell you how many they are getting. When we do, we'll let you know. But we'll work on making sure that if we have the list, we'll make it available to the public.
And I think from a perspective of how do you do it or what appointments are available, my understanding is that they are doing them at probably infrequent times. So bookmark the pages where you can sign up for appointments and keep refreshing on that. Check it a couple times a day and you might get lucky and get those appointments to pop up. You may also want to consider expanding your search, the stores that you're looking at. If you're only looking at a 10-mile radius, maybe you want to go 20 or 50 miles and you may find an appointment open. But like every other vaccine appointment, they're a hot commodity. So I think the best chance is just check frequently and see if any pop open.
And I think
I was just going to add, so it's clear to people listening that the pharmacists are also right now still focused on the 65 plus. So you have to be 65 plus to get the vaccine.
Somebody is asking about being 65 plus with a chronic condition and why that person isn't prioritized or be able to get a vaccine now.
If you're 65 plus, you qualify for the vaccine. The phases, again, what goes into the phase, that determination was not made by us, it was made by KDHE, the state. What we did in phase 2 is prioritize, again, based on the limited availability of the vaccine. So at 65, you do qualify, and the health systems that are giving the vaccines are not are giving it out based on 65 plus. So it's not whether you have a chronic condition or some serious condition. Right now, I don't think it factors that in. It factors into that. If you're 65, you qualify. For us, we chose to focus on the 80 plus, which is still a subset of the 65 plus, but all of the health systems are focused on 65 plus. You do qualify. If you have a relationship with any of them, you just need to be patient. If not, ensure that you go to their website, signify your interest as you have done on ours, hopefully. And as more vaccines become available, you will get your shot. You want the shot, we want to give you the shot.
You know, somebody on here just posted that they're signed up with every possible place and have not heard yet. I think that this is normal at this point. So I just think kind of our advice along the way has been every opportunity, you know, fill out our interest form. If your healthcare system has one, fill that out. If you come across a pharmacy one, fill that out. A good approach is to put your name on several lists, correct?
Correct, yes, correct.
So
but don't do it multiple times, just once
right.
on those lists, yes.
Once per list, but it's okay to do multiple lists. And I think we've also talked about your second dose. The approach really should be to get your second dose where you get your first dose. So even if you find somewhere on the Missouri side to get your first dose, you should plan on, you know, 3 to 4 weeks later, knowing you're going to go back there to get your second dose, correct?
That is correct. Now, we did hear last hour about some development from the Missouri side, but I think the concise message from us is, if you got your first dose from us, we have your second dose. Yeah.
Okay. Any closing remarks before we wrap up for today?
Elizabeth, you have anything to?
Not today. I will say I just got confirmation. I believe that we had a school clinic going on right now, and we do, in fact, it will be running until 8:30 at one of the Blue Valley facilities, who has allowed us to use it, allowed Children's Mercy to use it. So today and a clinic tomorrow. I would also say, I know a lot of people are thinking that if they show up at the end of a clinic, that maybe they'll sneak in and maybe there will be extra doses. We heard from our health systems. We've experienced this both in our own clinics as well as the Children's Mercy clinics. Please don't do that. For part of the reason is, if we do it once, then everybody's going to show up and we're going to have a line of 300 people waiting for those. Oftentimes clinics have standby lists that they're going off of and calling down. So while I know it may be tempting to go sort of stalk these different clinics, be patient. If you sign up for all of them, your chance will come. As Dr. Ariola said, if you want the vaccine, we want to give it to you. And hopefully moving forward, we will have increased doses and we can get it to you much quicker.
So I think it's a good message too, that we just hate for someone to make the trip, who knows how long they're driving to get there, and then they're going to be, it's not going to be a successful trip for them. So I think that's some good advice. Dr. Ariola, anything to add?
No, it's just always a pleasure to be able to speak to our residents, to answer their questions, and looking forward to talking to you all tomorrow again.
Well, thank you so much to Robin, our ASL interpreter. We really appreciate you being here. Thank you, Dr. Ariola. Thank you, Elizabeth. Again, thanks to those who are watching on Facebook and asking us questions. And we appreciate the interest in this topic, and have a good rest of your day. Thanks so much.